Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
We are going to study a very important topic from the head and neck region, that is triangles of the neck. Okay, so as you know, the side of the neck, it is somewhat quadrilateral. Okay, so which is limited above by the lower border of the body of the mandible, and there is an imaginary line which is drawn from the angle of mandible to the mastoid process. Okay, I'll show you in this picture. See, this is the side of the neck. It is somewhat quadrilateral in a shape. So which is bounded above by the lower border of mandible. Okay, and from the angle here, from the angle of the mandible to an imaginary line which is drawn from this angle of mandible to the mastoid process. So this is the anterior boundary or above boundary. Is it clear?
Yes, ma'am.
Then below it is limited by upper border of the clavicle. See, this is the lower or below, which is bounded by the clavicle. Clear?
Yes,
Upper and lower boundary is clear. Then medially by the midline. Correct? No, this is medially. Medially by the midline of the neck. Then laterally by the laterally by the anterior border of the laterally, or we can say posteriorly. Okay, so posteriorly by the anterior border of the trapezius muscle. See here, this is posteriorly. So both, this is the trapezius muscle. Trapezius muscle have two border, no, anterior border and the posterior border. So here posteriorly, which is bounded by which border? Narisha?
Ma'am, trapezius.
Yes. Trapezius muscle, which border, ma? The posteriorly, which is posteriorly, it is bounded by trapezius, which border?
Superior border, ma'am.
Superior border. There is anterior border and posterior border, no, for muscle. The
Yes,
front
ma'am.
side is anterior. So this is which border?
Anterior.
Anterior. Understood, right?
Yes, ma'am.
See, this is the muscle, sternocleidomastoid muscle. So this is the muscle divides the neck into two triangles, anterior triangle and back is the posterior triangle. Understood? So we will study about the sternocleidomastoid muscle. Actually, the sternocleidomastoid is a side muscle. Okay, the side of the neck which is bounded by a muscle that is known as the sternocleidomastoid. So this muscle divides the neck into two triangles. So this muscle passes upwards and backwards from the clavicle and sternum. From the word itself, it is correct. Sternocleidomastoid. So from the sternum and the clavicle, it takes origin. And where it goes for insertion? Sternocleidomastoid. So it goes to the mastoid process and the occipital bone. You understood? You understood, Narisha?
Yes, ma'am.
So the triangle in front of the sternocleidomastoid muscle is the anterior triangle, and the triangle behind the muscle is the posterior triangle. Clear?
Yes, ma'am.
So these are the anterior and posterior. See the sternocleidomastoid muscle. In front of the sternocleidomastoid muscle is the anterior triangle. And back of the muscle is the posterior triangle. Hope you understood thoroughly. Okay.
Yes, ma'am.
So first we study the posterior triangle. So which is behind your sternocleidomastoid muscle. So posterior triangle above, which is bounded by sternocleidomastoid anteriorly, and below, sorry, not above, below, anteriorly by the sternocleidomastoid and posteriorly by the trapezius and inferiorly by the clavicle. So we'll go back to the picture and check whether it is correct or not. See, this is the posterior triangle. So tell me, anteriorly what is here? Tell me the
It's
boundary from the picture.
sternocleidomastoid.
Posterior border of the
Anterior,
sternocleido.
ma'am.
And
Posterior
posterior
border
border
of the
of the
sternocleidomastoid muscle.
then posteriorly what boundary?
Right trapezius.
Anterior border of the
Trapezius muscle.
anterior border of the trapezius. Tell me. Then inferiorly what?
Right. Clavicle, ma'am.
Inferiorly clavicle. Very good. Then apex. What is apex here?
Occipital bone.
Very good. So you understood, right? Then the roof. Roof means skin, superficial fascia, platysma muscle, and investing layer of the deep cervical fascia. Okay. Then what is the floor? Roof you understood. Floor means always muscle. So what are the muscles in the posterior triangle? Splenius capitis, levator scapulae, posterior scalene, middle scalene, anterior scalene. So 3 scalene muscle, anterior, middle and posterior.